How the Affordable Care Act was created. In early 2010, the Patient Protection and Affordable Care Act, ACA, Barack Obama's signature law, was in trouble. Ever since the New Deal, Democrats had campaigned on providing universal health care coverage to Americans. Harry Truman called for universal health care as part of his Fair Deal. Lyndon Johnson created the Medicaid and Medicare programs in the 1960s, but fell well short of covering every American. Bill Clinton's administration came the closest, proposing an ambitious single-payer structure like that of many other developed nations, but the effort ended in an embarrassing political and legislative disaster. The American healthcare system was a messy hodgepodge of lightly regulated employer-provided health insurance, subsidized through the tax code, and public single-payer programs for seniors, children, veterans, and the poorest families. But America's private employer-based system had been established for decades. All previous attempts to reform the system ran up against opposition from stakeholders and apprehension toward change from normal Americans. When Obama's administration set out to craft major health care reform, many Democrats saw it as a dangerous third rail. Rather than pursue a radical change to the American health care system, the Obama administration sought to create a universal health care framework that preserved much of the existing system, whereby most Americans were covered by private health insurance. The ACA was a vast and complicated law which included tax increases, new exchanges where individuals could purchase health insurance, regulatory changes, and a large expansion of Medicaid, the federal government's program to help states provide health insurance to poor families. These alone would have gone a long way toward expanding insurance coverage, but they were plagued by the core problem that American healthcare reformers had struggled with for decades: adverse selection. Healthy people don't want to buy health insurance and pay premiums until they get sick and need expensive care. But any insurance company would go bankrupt if too few of their plan holders were healthy. Thus, insurance companies refused to cover the care of medical conditions that the patient knew about before buying insurance from them, known as pre-existing conditions. By the mid-2000s, tens of millions of Americans were unable to buy health insurance. Previous Democratic attempts at comprehensive health care reform addressed the adverse selection problem by just providing everyone with government-sponsored health insurance, paid for with tax dollars, but the Obama plan would need a more creative policy alternative if it wanted to require private companies to sell affordable insurance to people with pre-existing conditions. The solution that they decided on originated in the unlikeliest of places: the Heritage Foundation.